Here's the problem. If an insurance company has to take you, has to insure you, even if you're sick, but you don't have an individual mandate, then what would everybody do? They would wait till they get sick, and then you'd buy health insurance, right? No point in use. I mean, it's just like your car insurance. If you could buy, if the car insurance companies had to give you insurance, you just wait till you had an accident, and then you'd be dialing on the phone, from the wreck, and you'd say, State Farm, I'd like to buy some car insurance, please. So that's why the individual mandate's important. Because the basic theory is, look, everybody here at some point or another is going to need medical care. And you can't be a free rider on everybody else. You can't not have health insurance, then go to the emergency room, and each of us who've done the responsible thing and have health insurance, suddenly we now have to pay the premiums for you. That's not fair. So if you can afford it, you should get health insurance just like you get car insurance. This should not be controversial, but it has become controversial partly because of people's view that, well, let me just say this. You've got a governor who's running for president right now who instituted the exact same thing in Massachusetts. This used to be a Republican idea, by the way, this whole idea of the individual mandate, and suddenly it's like they got amnesia. It's like, oh, this is terrible. This is going to take away freedom for Americans all over the world, all over the country. So that's a little puzzling.
That Hillary says that they didn't represent her properly. They misrepresent her. Did they, and what do you say about that?
Well, obviously, I think that they represented her position properly, which is that she supported in the past NAFTA, which has been pretty hard on Ohio. And we've had an ongoing discussion about health care. Both of us want to provide health care to all Americans. There's a slight difference, and her plan is a good one, but she mandates that everybody buy health care. She'd have the government force every individual to buy insurance, and I don't have such a mandate because I don't think the problem is that people don't want health insurance, it's that they can't afford it. So I focus more on lowering costs, and this is a modest difference, but it's one that she's tried to elevate, arguing that because I don't force people to buy health care that I'm not insuring everybody. Well, if things were that easy, I could mandate everybody buy a house, and and that would solve the problem of homelessness. It doesn't.